After many videos about blood and blood vessels and circulation, we finally come to the heart. People used to think that the heart was the source of our feelings, our emotions, our passions, our desires, our love, until they found out that the heart was nothing more than a muscle that pumped blood around the body. Of course, to this day, we still use the heart to represent love. We still talk about that conflict between our heart and our brain and trying to, torn between our feelings and our logic. But really, what we've come to see is that the heart is really just a muscle, a very important muscle, but it really has nothing to do with emotions at all. Those have a lot more to do with your brain. Well, for the rest of this video, we're going to look at the heart. We're going to ask and answer the question, what are the main parts of the heart? How does blood flow through the heart? And what are the main blood vessels that come out of and go into the heart? So these are the textbook pages as we go along this segment. Let's start with a simple recap. A few videos ago, we talked about the difference between arteries and veins. Arteries, of course, are the blood vessels that carry blood away from the heart. And veins are the blood vessels which carry blood toward or into the heart. And in the last video, we talked about double circulation. So remember, there's a pulmonary circulation. And in that pulmonary circulation, there are two main blood vessels. There's one blood vessel that brings blood from the heart to the lungs, and one that brings blood from the lungs back to the heart. And then there's the systemic circulation. In the systemic circulation, there are also two very important blood vessels. One of them brings blood from the heart to the body, and the other main blood vessel brings blood from the body back to the heart. So pause at this point. I want you to think of the question. There are four blood vessels, main blood vessels, that bring blood to and fro from the heart. 1, 2, 3, and 4. I would like you to label 1, 2, 3, and 4, whether it's an artery or a vein, right? Based on this knowledge that you have here. So hopefully that wasn't too difficult, because actually you've learned some of this in Sec 2 before. Let's come back to our diagram here and talk about each blood vessel one by one. So let's start with number 1. Number 1 brings blood from the body toward the heart. So toward the heart, this is a vein. And this vein has a special name. It's called the vena cava. So the vena cava, number 1, blood vessel 1, here, carries blood, deoxygenated blood, from the body back to the heart. Now let's move on to number 2. Number 2 is a blood vessel that carries blood away from the heart to the lungs. So away, so this is an artery. And because it has to do with the lungs, it is called the pulmonary artery. So pulmonary artery is number 2. It carries deoxygenated blood from the heart to the lungs. Now number 3. Number 3 carries blood from the lungs toward the heart. So toward the heart, number 3 is a vein. And because it has to do with the lungs, we call it the pulmonary vein, number 3. So the pulmonary vein carries oxygenated blood, a red arrow, from the lungs toward the heart. And that leaves us with blood vessel 4. It carries oxygenated blood from the heart to the rest of the body. So away from the heart, so this is an artery. And it has a special name, it's called the aorta. So the aorta is number 4. Carries oxygenated blood from the heart to the rest of the body. Okay, so you must know these 4 main blood vessels that come out of and toward the heart. And now we're going to talk about what are their functions. So for example, we will say that the vena cava, blood vessel 1, carries deoxygenated blood from the body to the heart. Right, this is how we summarize the function. Now I want you to pause the video here and do the rest yourself. So I want you to write a similar statement for blood vessel 2, 3, and 4 in your notes. Once you've done that, you can move on with this video. Alright, before we leave this diagram, we're going to just answer a few important questions. Firstly, people often say that arteries carry oxygenated blood. However, do all arteries carry oxygenated blood? Well, based on this diagram, the answer is no. Why? Because there is an artery in this diagram which carries deoxygenated blood. And hopefully you've realized that the artery is Number 2, the pulmonary artery. Pulmonary artery is an artery, but it carries deoxygenated blood away from the heart to the lungs. Now similarly, let's come back to this second question. A lot of people say that veins always carry deoxygenated blood. Is that true? And the answer again is no. Because from this diagram, we can find one vein which carries oxygenated blood. And hopefully you realize that that vein is number 3, the pulmonary vein. The pulmonary vein carries oxygenated blood from the lungs back to the heart. Okay, so get familiar with this and the main blood vessels and what kind of blood they carry. Let's dive deeper into our heart now. So this diagram is going to strike terror into a lot of biology students. It's like, it's so complex. But don't worry, we're going to look at it together. And first, let me convince you, or at least try to persuade you, that it is important to know about the structure of our heart. Now, did you know that heart disease is one of the leading causes of death in Singapore? After cancer, the next biggest cause of death is heart disease, heart attack, cardiac arrest, which we're going to look at later on in this chapter. But it's important to understand the structure of our heart so that we can know how to help such diseases. And then there are diseases of the heart which people are born with. Now, if you're born with a disease, we call those diseases congenital disease. Right? That means it's something that you're born with. Now, I've known some people who are born with this condition called the hole in the heart. You might have heard of that before as well among your family. The scientific medical name for it is the tetralogy of Fallot. And in this condition, there is a hole in the heart, as you can see here between the left and the right side of the heart. And there are problems with some structures in the heart, some valves in the heart have issues. And you'll see how this affects those babies which are born with holes in their heart. So we need to understand the structure of the heart, the normal structure of the heart, so we can know that when things go wrong, what happens, what's the effect, and how can we help to make it work like a normal heart again. Hence, this chapter on the heart is really important. It's really close to your heart, right? Because all of us have a heart. So in the next video, let's jump in and look at the detailed structure of the heart.